good afternoon and welcome to day 5, the final day of the Iowa Cancer Summit. My name is Liz Orton. I'm the outreach coordinator at the Iowa Cancer Consortium, and my pronouns are she and her. As we get started today, we'd like to invite you to introduce yourself in the chat box. Let's see. And then we are so grateful for our sponsors this week. We've got some good ones, so we just want to shout out to the Iowa Department of Public Health, the Holden Comprehensive Cancer Center, and the Iowa Oncology Society, as well as everyone else on there. And then a few reminders before we get started. If you are receiving continuing education credits, today is 1.5 credits for nursing and 1.5 for CHES. And if you have any questions, reach out to Kelly Rollins, and you'll be getting an email after the session today with an evaluation to fill out for us, for the Iowa Cancer Consortium. And then if you're getting nursing credits, keep an eye out for an email from the University of Iowa because they have a required one to get those credits. All right, so we ask all participants to turn off your video while people are presenting and make sure you're on mute. And the session will be recorded and we'll make that available after this week. And all right, I'd now like to introduce Kelly Wells-Siddig, Executive Director of the Iowa Cancer Consortium.
Thanks, Liz. Hello, everybody. Welcome to day 5. My name is Kelly Wells-Siddig and my pronouns are she, her. Liz and Rachel, I'm actually going to ask you to show your faces super quick, if you would. Before we get started with our membership meeting, I just want to take a moment to thank Rachel Schramm and Liz Orton on our team here. It takes a lot of work to put together a 5-day event, even virtually. And these two have made an incredible team and have worked really hard to bring speakers to all of us and to coordinate things so that they're smooth and so that everybody has a really good experience. So Rachel and Liz, thank you for all of your work to bring the summit to us. Thank you. So during each Iowa Cancer Summit, even if we're in person or virtual, we take a little bit of time for some membership updates and to introduce you to some individuals who are impacting cancer control in Iowa. And I get to do that here for a little bit to start us off today. The strength of a coalition like the Iowa Cancer Consortium is really in the fact that it is an engaged network of people working towards the same goal, and in our case, that's a reduced burden of cancer in Iowa. In our case, you've heard us say that our network has recently become more than 500 strong, which means that those of you who are members here today have 500 teammates who are bringing their strength and resources to the collaborative cancer control table here in Iowa. Over this past week, you've been introduced to just a few of them, and you'll get to meet even more of them today. And if you take away one thing from this first part of our time together today, I hope it's that you have these folks and 500 others in your network and available for you to connect with when you need partners in cancer control. If you're not already a member, I hope you'll take the opportunity to join. We've got a QR code up here on the screen for you, and just in case you didn't get your phone out fast enough, we've got it on the next few slides too. So you can scan that, it'll take you to some information about all of the benefits of becoming an Iowa Cancer Consortium member. So this idea of our collective strength and knowledge and skills is really at the heart of our strategic plan, which I know many of you have heard about already. This will be one of our guides over the next year and few years. Specifically, this plan calls for us to increase our focus in 2 cross-cutting areas throughout cancer control. The first is strategies that advance equitable cancer control across all populations. And the other is advocacy for policy systems and environmental change to reduce the burden of cancer. So over the next few years, we'll continue to build individual, organizational, and collective capacity, all of us together, in all of these areas. And occasionally, we'll do some temperature taking, like we're going to do right now. So if you'll bear with us, we're going to ask you to get out your phone or open up another browser tab to participate in some Mentimeter questions. And if you went to our spring meetings, you've done this before. There are 3 ways to participate. You can go to menti.com and enter code 5953-5136. And I know you'll have that available to you. You can use the QR code with your smartphone camera or look for the link in the chat.
Kelly, is that okay if I transfer over to Mentimeter?
Yes.
Okay.
Yes. There
Okay.
should be a link in the chat for those of you who haven't had a chance yet to log on. The first question is an easy one, maybe. We actually know that this can be a difficult question to answer. So are you an Iowa Cancer Consortium member? Let's see who's with us today. You've got 3 choices here. As always, they're represented by adorable pets because that is our brand here at the consortium. So if you'll take a moment to answer the question. All right. Give you a few more seconds here, but it looks like we've got folks, lots of Cancer Consortium members. All right, part of our 500 strong here. All right, wonderful. So we talked about advancing all of our work individually, together as a network in 2 areas, the first being equity. So I want you to take a second to look at these options and tell us where you are in your equity work. Are you finding your way? Are you a work in progress? All right, making moves. Are you teaching and living this, or is it not part of your plan? I love these gifts. Isn't the world better with gifts? I really think it is. We'll give a few more seconds to vote. All right, we've got some people we can learn from too, it looks like. Most of us are making moves. This is great, thank you. I'll let you know that we'll share these results in follow-up communications about the summit in case you're interested. We'll let you know how the voting turned out. All right, so next let's talk about advocacy work. Oh, sorry, I got excited, moved ahead. Tell us what would help you make progress. So if you were in the just starting to think about it category, what would help bump you just one little bit in the progress direction? Let us know what might be helpful. More connections, great news, great news. This is what the consortium can help with. What else? Don't be shy. This is anonymous. Meeting more leaders. Yep, we saw that a lot in the strategic planning process. Folks want to meet others. Great. Awesome. This is wonderful. Thank you. And again, we'll send this out. So if you didn't get a chance to read all of them, you will get to. Now, I got very excited to talk about advocacy. Let's shift and think about our advocacy work. Where are you within your own advocacy work? Are you finding your way there? Are you a work in progress? All right, making moves. The world is better with gifts, and the world is better with Leslie Knope too. I don't know if you all are fans of Parks and Rec, but we are definitely here on the staff. All right, great. Got some teachers here too. Work in progress. All right. And so you probably know what I'm going to ask you next, and that is what would help you make progress in your advocacy work? That will be the next question that we'd love to hear your answers to. And as you're answering, I'll explain that our new strategic plan really calls for our staff and every member of the consortium to work together to help us all make progress in this area. So whether it's making progress individually in our own jobs in equity and advocacy, whether it's making them as a work group at the consortium, whether it's making progress as an organization, whether it's making progress as a state, we're going to find ways and lean into ways to make progress and move forward in advocacy and equity, which is why we're asking these questions today. Got a couple more seconds if you would like to share your answers. Thank you. Time, man, I feel that. I think we all feel that these days. Yeah. All right. Thank you so much for sharing your feedback. Again, we'll share that with you so that you can get some ideas and think about what your fellow consortium members had to say. So those of you who have been consortium members for a while know that one way to make progress in these areas and in others is to participate in a work group or a committee through the consortium. Here you can see a list of our most active work groups and committees that are all open to members. This is a really great way to connect with others throughout the state, to share work, resources, expertise, and effort. And I just want to do a little call out of our newest member, our newest baby work group, the rural work group, which has existed for less than a year. It's currently led by Dr. Mary Charlton, who we heard from yesterday, and Lori Pedig. The purpose is to increase quality care throughout the cancer continuum in rural Iowa. Meetings are held on the third Thursday at 10 a.m. This is something you're interested in, you're not sure how to sign up, just reach out to a staff member. Maybe we can drop the staff email address in the chat and we'll make sure to get you signed up. And the same is true for all of these work groups or committees. And speaking of rural work, I want to let you know about an opportunity that we have right now for consortium members and partners. And that is we are sponsoring, the Iowa Cancer Consortium is sponsoring free One Iowa trainings for rural providers specifically and rural cancer control practitioners. So if you've never been through a One Iowa training, they're amazing and they help us all be more inclusive and welcoming and affirming of folks who identify as LGBTQ, which is so important in public health, in healthcare, and in life in general. And the consortium will support your training for providers at your clinic or your health system or your public health department. All you have to do is reach out to Liz to get one scheduled, and her email and phone number are right there on the screen. All right, and so obviously all members, I hope, are also familiar with the Iowa Cancer Plan, which is at the heart of what we do and is meant to be our state's roadmap to a reduced burden of cancer in Iowa. And believe it or not, we are gearing up for the next plan revision. So the current plan takes us through December of next year, 2022. But the revision process is long and involved, as it should be. And so therefore we'll start reaching out to work groups and members and stakeholder groups over this winter, which will be here before we know it, to start strategizing and strategizing about how to update the plan. Some known additions to the plan will likely include things like a greater focus on childhood cancers, genetic counseling, hepatitis C, disaster preparedness as related to cancer control. And if you were here yesterday, we had a great conversation about how we in healthcare and public health talk about weight, which is likely to be part of our next cancer plan. The cancer plan is guided by metrics, of course, and we have a guest with us today. We lean very heavily on the Iowa Cancer Registry for their data expertise, and Amanda Call with the Iowa Cancer Registry is going to briefly give us an update on cancer incidence and mortality targets. Amanda, welcome.
Thank you. Yeah, so again, I'm Amanda Call, and I'm a data analyst at the Iowa Cancer Registry. And today I'm going to go over the data targets slide. Before we get started, I just want to do a quick review of terms so we're all on the same page. Incidence is the number of new cancers diagnosed during a specified time divided by the population at risk for developing cancer. An example of this would be if a county has 100 cancer cases in a population of 50,000 people, the rate would be 100 divided by 50,000 or 0.002. The way we express this is that we actually divide that or multiply that number by 100,000, and we express it as 200 cancer cases per 100,000 people. Mortality is the number of cancer deaths that occur during a specified time divided by the population. And all rates that I'm going to show today are age adjusted per 100,000 persons. And so age adjustment is a statistical process applied to rates of disease, which allows communities with different age distributions to be compared. Slide. So the Iowa Cancer Plan goals have data targets for cancer incidence and mortality, which are benchmarks that are used to measure and evaluate progress towards the outlined goals. Looking at the creation of the 2022 targets, 2012 to 2014 cancer data was used to establish the baseline rates, and then cancer incidence and mortality rates were predicted for 2022 if no interventions were implemented. Incidence targets were set using a % reduction from the projected 2022 rates, and mortality targets were set based on Healthy People 2020 recommendations. The cancers presented today are the cancers included in the Iowa Cancer Plan. Slide. So this graph is showing all cancer sites combined. The dark blue solid line are the actual incidence rates. The light blue dashed line is the incidence 2022 target goal. The dark orange line are the mortality rates, and the light dashed orange line is the mortality 2022 target. So as you can see, the incidence of all cancers in Iowa has been pretty steady over the years. Mortality, on the other hand, has been slowly decreasing over time, and we're getting close to reaching our mortality target. Slide. Female breast cancer. The incidence on this slide is specifically for late stage breast cancer, while the mortality is for all stage breast cancer, or any stage. The incidence has remained pretty steady over the years, and for late stage breast cancer, and the overall female breast cancer mortality, regardless of stage, has decreased, and we are actually under our targets, so we've reached that. Slide. Looking at cervical cancer, the incidence was fairly steady, and then in the 2011 to 2013 timeframe, it started to increase a little bit, while mortality has remained constant at a low rate over time. Slide. Looking at prostate cancer, the incidence has been decreasing and is now beginning to increase a little bit in later years. Prostate cancer mortality has remained fairly constant over these time periods. Slide. Looking at colorectal cancer, incidence is steadily decreasing, and colorectal cancer mortality has been decreasing, and we're very close to reaching our mortality target. Slide. Lung cancer incidence and mortality have also been decreasing, and actually looking at the lung cancer mortality, we are below our target, so we reached that in the 2016 to 2018 time period. This is great news that incidence and mortality are decreasing, but we do need to keep in mind that Iowa's large white population masks what is happening in the Iowa Black population. I recently saw some statistics that Iowa has one of the highest rates of lung cancer incidence in the country in the Black population. So something to keep in mind. Slide. Looking at liver and intrahepatic bile duct cancer incidence, it's been steadily increasing, as has the mortality. I would like to note for this slide and the next that while the target goal is higher than the baseline, it is a reduction of the projected rate for the final reporting period. Slide. And then looking at skin melanoma, incidence has been increasing quite a bit over the time frame, while skin melanoma mortality has been close to the target goal, if not slightly below it, for this entire time frame. And that's all I have for you today. Thank you.
Thank you so much, Amanda, and thanks again to our partners at the Iowa Cancer Registry. So this is a lot of really important information, and there's a lot to take in and process here, so much more than we could in 5 quick minutes. So I'm going to tell you 2 things. First, I'm going to put Amanda on the spot and ask her to drop her email address in the chat, if she would, if she's still available to do that, so that if you have questions about the data specifically, please reach out to her. You can also reach out to the staff at the consortium, and we'll connect you with folks at the registry. But 2, this is going to come into play again, when we start to work on the cancer plan revision process. So there will be lots of opportunities for us to all process this data, talk about what it means, and what it means specifically for the cancer plan coming up over the next year, which is another really great reason to make sure that you're engaging with the consortium. You've got your membership up to date so that you can be part of that really important cancer plan revision process. Thank you, Amanda. Thank you so much. Really appreciate you. And now we get to move into what is always such a fun and wonderful and fill your cup kind of piece of the Iowa Cancer Summit. We get to talk about 2 new recipients of Cancer Control Awards here in the state. So the first award we're going to present today is the Spirit of Collaboration Award, which honors an Iowan with an outstanding commitment to collaborative cancer control efforts in Iowa. And the recipient must be an Iowa Cancer Consortium member. And our recipient this year, I'm so pleased to announce, is Lori Pedig. Lori became the first ever Cancer Services Director in the summer of 2020 and oversaw the opening of St. Anthony Regional Cancer Center in December 2020. She served St. Anthony for more than 17 years and was also Director of Radiology from 2013 to 2020. I'm going to read a little quote from Lori's nomination. I am not sure the consortium has ever had a member quite like Lori Pedig. Being new to her position in a brand new cancer center, Lori brings a wealth of knowledge about her community and medical care and openly shares process information about her programs with others across the state, even inviting leaders and staff from other hospitals in Iowa to tour their facility and talk shop about how to bring services to rural areas. Similarly, she's not afraid of taking risks, which makes her work full of innovation and growth. From a newly formed clinical trials recruitment program to lung cancer screening and enhanced social supports for their patients, Lori makes it look easy. So true. She participates in nearly every meeting focused on rural work and recently became a co-chair of the consortium's Rural Cancer Work Group. We are so thankful to have Lori in our network and look forward to many future collaborations. Lori, congratulations. So happy for you. Wish we could give you a really loud round of applause. And we invite you to say just a few words if you have anything you'd like to say.
I would just want to thank you, Kelly, and the whole entire team for not only making this job available and be able to be part of this group to really speak for West Central Iowa and what we do as a community here in Carroll. And we are just looking forward to more collaboration and more opportunities to spread the message, help each other, and really make cancer control part of our initiative.
So Lori, George Weiner here, and on behalf of the ICC board, I would like to congratulate you and thank you mostly for your commitment to cancer control.
Thank you.
And obviously without leaders like you, the consortium would not be able to have anywhere near the impact we're able to have. So thank you and congratulations.
Thank you very much.
So much, Lori, we appreciate it. And I may not have caught it, but do you have your award with you there?
I do. I
Did you
opened
show
it
it
this
already?
morning.
All right, lovely. So
Beautiful.
well deserved. Thank you.
Thank you so much.
Thank you. Thanks for all you do. All right, our next award is the Iowa Cancer Champion Award, which is given annually to an individual or organization who demonstrates a commitment to reducing the burden of cancer in Iowa through work on policy, systems, and environmental change. And this year, we're so pleased to present this award to Maria Steele. Maria grew up in Granger, Iowa, and had a nursing career that spanned 40 years and included working as an RN and a family nurse practitioner at the University of Iowa. In January 2020, she was diagnosed with stage 4 lung cancer due to radon, and her new focus is spreading the word that the whole state of Iowa is a danger zone for radon. I'm going to read a little bit from her nomination as well, which makes it so clear that she's such an effective advocate. Maria had a Des Moines Register editorial sharing her cancer story and calling for people to test their homes. Her blog has hundreds of followers where she and her husband, Pat, educate and entertain with credibility and kindness. Maria and Pat did a session of the cancer education series that was the most popular of all, recordings totaling more than 580 views, and that's from Above and Beyond. You can see that video on the Above and Beyond Cancer YouTube channel as well. Maria has viewed her cancer journey as an opportunity to achieve great feats, such as biking in every state and in every county in Iowa. She's a living example of the positivity and power cancer survivors can share with the world. Maria Steele is a true Iowa cancer champion. Maria, thank you so much.
Thank you, Kelly. Wow, this is really an honor, and I'm really humbled by this. And I'd like to thank Chris Goodell from Above and Beyond Cancer for nominating me. I had no idea I was even being nominated. And of course, I want to thank the Iowa Cancer Consortium, because what an amazing organization, as Kelly said earlier. I've been in healthcare for many years, but it's a whole nother deal to be the patient and be sitting on that exam table. So I really do want to thank my medical teams, both Dr. Deming, his nurse Kelly, and Above and Beyond Cancer. So many people are there to empower us to help find joy, even with a cancer diagnosis, and to spread joy. And also Dr. Behrens and his nurse Krista, as well as Dr. Andy Nish. I mean, so many people, they may just think, hey, I'm doing my job, this is my life's work, but being on the other side of the exam table, it's a whole nother situation. And I want to thank them for helping me make this cancer journey possible. And lastly, I want to thank my family for supporting me, my husband, Pat, our kids, Zach and Val, and their spouses, and all the extended Meyer and Steele families. I mean, they're there for me. And I really appreciate it. And I really hope people get their houses checked for radon, because the prevalence in Iowa, as Dr. Fields said on Wednesday, that's what blew me away. I mean, we knew about radon, but the prevalence, that needs to be shouted from the rooftops to be checked in each of our homes. So, but again, thank you. I'm very, very humbled by this, and I really appreciate it. Thank you.
Well, again, Maria, George Wiener here, and on behalf of the board, congratulations. And, you know, it's one thing to work on cancer control professionally. It's another thing to be willing to share your own personal story and go public with that as a healthcare provider and then as a patient. And that makes you that much more believable to people out there. And I have no doubt that you've saved countless lives in the years ahead by encouraging people to think about radon, get tested, and get mitigated. So thank you so much.
You're very welcome, Dr. Wiener. Thank you for your kind words.
Yeah, thank you so much just for everything you do. And I just want to note here on the staff, we've been talking about how we can help folks beef up their Rolodexes. So some of you may be young enough to remember what a Rolodex is. Well, I would say these are 2 women that you want in your Rolodex. And so I hope you'll take a moment to help reach out to them, say hello, say congratulations, and make a really important connection that's going to help you do your cancer control work even bigger and better. So again, thank you, Lori. Thank you, Maria. Appreciate all you do for cancer control in Iowa. Beautiful.
Thank you.
Lovely.
Thank you guys.
So much.
It's a
Thank
pleasure to work with all of you.
Same here. Exactly.
This is great. Thank you. All right. Rachel joked this morning. She said there are going to be feelings today. There are going to be feelings. I think it's Feelings Day at the Iowa Cancer Summit. It's so good. We got to remember the feelings part of it. And with that, we get to move on to the next piece of our agenda. And we're going to hear from some members of our board, consortium members who are working in oncology, working in cancer care provision right now, to hear a little bit of reflection about the state of things in the, I won't say following COVID, because we all know we're still in the middle of it. And to moderate our conversation today, I'd like to introduce board member Dr. David Dickens. Dr. Dickens?
Good afternoon, Kelly. Can you hear me okay?
Yes.
Perfect. That was a very tough segment to follow. So congratulations to the award winners, and I look forward to continuing to work with all of you. It is my pleasure to introduce this distinguished panel of people to talk about a subject that has been so ingrained in our culture. It does become fatiguing at times to talk about it, but there were many lessons that we all have learned, and we hope to share through managing, a diagnosis that never got quarantined during a worldwide pandemic. The speakers that we have today on our panel include Dr. Weiner. Dr. George Weiner is the president of the Iowa Cancer Consortium Board of Directors. He served as the director of the University of Iowa Holden Comprehensive Cancer Center, which is a National Cancer Institute designated comprehensive cancer center since 2000, so the entirety of the 21st century. He's received his BA from Johns Hopkins, MD from Ohio State, internal medicine training at the Medical College of Ohio, and he was fellowship trained in HEMOC and immunology at the University of Michigan. He's had a number of leadership positions, including chairing the NCI committee that provides peer review of cancer centers, and also as a president of the Association of American Cancer Institutes. He currently chairs the external advisory committees for 6 other NCI designated cancer centers, and is also the chair of the Society for Immunotherapies, as he said to me once, before it was cool, of Cancer Policy Committee, and is a member of the National Cancer Policy Forum. Also is Dr. Richard Deming, the vice president of the Iowa Cancer Consortium Board of Directors. Dr. Deming is the medical director of Mercy Cancer Center in Des Moines, Iowa, and a founder of Above and Beyond Cancer. He got his bachelor's degree at South Dakota State University, medical degree at Creighton University. Dr. Deming is known in the community for the compassionate care he provides cancer patients and their families. He's involved in many national, state, and community organizations, and has received many awards for his work, including the Lane Adams Award by the American Cancer Society for excellence and compassion in patient care, and the Iowa Cancer Champion Award for his tireless efforts in the field of advocacy. He's dedicated to the principles of human dignity, social justice, and compassion. His greatest ambition is to encourage others to pursue lives of meaning, purpose, passion, and compassion. 2 more members, Kara Erlis-Comer. Kara is a registered nurse on the senior leadership team at Wayne County Hospital in Corydon. She provides administrative oversight to the hospital's specialty clinics in which oncology services are located. Her experience is in oncology and hospice, and she continues to have a passion for oncology, even though in her current role, she's no longer at the bedside. I also, in addition to moderating, will be a member of the panel as it's appropriate. I, for the sake of time, will tell you I'm a pediatric oncologist. For the last 20 years, it's been my privilege to say that I cured children with cancer. And that has required me to be at a whole lot of places and do a whole lot of things. So we are going to start with the first question. I will start with Kara then. And my question for you, and we'll go around, feel free to pass if you need a little bit more time. What I think this group might be interested in knowing is, as a leader at your cancer center, over this entire pandemic, what have been your biggest concerns that you've had about your staff and your patients, and what kind of strategies did you use to mitigate those?
Well, thank you. Can everyone hear me okay? Okay, great. Hi, Dr. Deming.
Hey, Kara.
Well, I'll tell you, it is a little bit different. I have been a nurse for 33 years. I've been in rural and urban hospitals alike, and this pandemic hitting a rural hospital, I think, has affected us very differently than it would have been in an urban setting. And that is largely due to the footprint of our facility and the amount of entrances we have. We have very limited entrances. So, and our facility is all pieced together. So inpatient, outpatient, our largest clinic, radiology, laboratory, all uses the same entrance and exit points to get in and around our facility. So in real normal life, that didn't cause quite such a problem. In fact, it made for wayfinding to be very easy, was very easy to secure our facility. But now we're talking about oncology patients entering the same door and checking in as COVID positive patients potentially or really. And it became not only for our oncology patients, but all the other well patients and pregnant mamas and everybody, it became a, oh my gosh, what are we going to do? There's only very few ways we can get patients in and out of our building. So we have a very creative and nimble CEO down here at Wayne County Hospital. And he actually pulled in, think of it as a semi-trailer without the cab on it. And we pulled that into a different part of our parking lot and outfitted it with exam rooms, a registration, a bathroom, and a lab, so that we could see any symptomatic or infectious type patients out there, therefore keeping our well patients and specifically our oncology patients in the clean area of our facility.
Super. Dr. Deming, same question. From a patient and staff perspective, what kind of challenges have you had to deal with and what kind of strategies have you used to mitigate them?
Yeah, so many challenges, and I think many are in common, but I love the way you brought the panel together. So Kara, who's in a distinctly rural setting, Dr. Weiner, who's at the university setting, and I'm at a comprehensive community cancer setting. So we really do have three completely different settings. So I could talk about a lot of things that are in common, the reduction in screening and the reduction to access to care and how we intentionally slowed things down, for fear in March of 2020 that we just wouldn't be able to take care. But I want to focus on something that others might not say, and that is the compassionate care piece. As we instituted with the right intentions, the restriction of who can come in and making cancer patients with incurable cancer come into the clinic all by themselves. And we approach them with face masks and shields. And typically when I see someone with incurable cancer, the conversation is, what's brought you the most joy since I last saw you? How do we bring more joy into your life? How do we put your mind at ease and know that you are totally surrounded and supported as we go through this journey? But what we were saying with our actions is, we can't hug you. We can't let your family be here. You are isolated. And it works in both directions. Not only was the patient feeling isolated, afraid, and alone, but those of us who are compulsive huggers and use physical touch as part of our healing, we're feeling like we were stripped of one of our powerful tools of healing. So that's an aspect that I had noticed. So what did we do? We made compassionate exceptions, and we made liberal use of compassionate exceptions for family being able to visit. So just a different perspective. I could give you statistics on the decrease in cancer screening and how that's going to increase death rate, but the human element of it was also significant.
Well, I agree with both Kara and Dick on the issues, and certainly the visitor policies was incredibly painful that we had to implement, despite understanding why. What I thought I could focus on is the fact that we have three different missions here, and yet they all interact. And the pandemic really interrupted how those three different missions interact. So if we look certainly at our clinical mission, you've heard some of the issues already. From an educational mission point of view, we basically had to remove learners from the clinic. And that disrupted things in many ways. It just changed the workflow and how we usually operated in the clinic. And it certainly impacted on the med students and the other trainees as far as their experience went. And so we had to come up with alternative ways to teach for a period of time. Those trainees who provided care, such as residents, also, it was a totally different experience than what they'd had before. And we really had to change how we operated. We didn't make rounds with 6 or 7 people coming into the room at the same time. We had to do things very differently. And we actually learned some positive lessons from that. From a research point of view, for a while there, we had to shut the labs down. That didn't stop the research. People, in many cases, had gathered a lot of data that they hadn't had time to analyze. So people were able to sit at their desks at home and actually do in silico research and take the data they generated and continue to use it. But for other people who needed to be in the wet lab, that was disrupted. And from a patient care point of view, the pandemic had a real impact on clinical research. We had great support from the institution in being able to continue with our therapeutic clinical trials. So we made the argument that if a patient is on a therapeutic trial, as long as the sponsor allows us to continue, we need to continue because that's how that patient is getting access to the therapy. And in fact, 2021, we had a greater accrual to therapeutic trials than any year we've ever had, despite the pandemic. On the other hand, there were some trials that were non-therapeutic trials, some observation trials, or trials that involved patients who were willing to give us blood samples that we had to stop. And that impacted on our ability to enroll patients in some studies. So all in all, it really required creativity every step of the way and flexibility and teamwork. And again, I was incredibly proud of how our entire staff dealt with these issues while also exposing themselves to risk by continuing to do their jobs.
Thank you. Now switching hats as a panel member and continuing on with the spirit of adding on top of the observations that are shared amongst all of these different spheres. I would have to add, picking up on that last comment, that that our care, the compassionate care we deliver is delivered mostly by the team of people that I work with. The proportion of time I spend in a room is relatively small compared to nursing and social work and child life and all the other team members. And back in the beginning of this crisis, when there was still a lot of uncertainty and fear, that I saw a big impact on the staff that was delivering the care. We were at a time where people were taking their clothes off when they got home and putting them right in the laundry. And do I need to wash my groceries when I come home? There was a lot of fear. And as I said, cancer did not get quarantined. My observation on the peds side is the same as George described. We actually, from between 2019, 20, and 21, had about a 10% year-over-year growth in our patient volume. In the entire Children's Hospital at the University of Iowa, there have been 93 COVID cases that have entered the hospital system. And since the beginning of this pandemic, 28 of our patients have gotten COVID. Sometimes it's right at the diagnosis, sometimes it's on treatment. And so this fear that everybody has been walking around with about potentially catching something that could make them very sick or worse, I'm diagnosing them with cancer and COVID. The national statistics for COVID in pediatric cancer indicate that there's a 4% mortality rate nationally. This is about 1,000 or so patients. And that's about 400-fold higher than pediatric mortality rates in general from COVID. So they kind of had a double whammy thrown at them. We've been very fortunate. There has not been a single one of those 28 patients that has required intensive care as a result of their COVID. So I feel very fortunate to be practicing in a place that has remained up to date on the management of COVID. So I find that managing all of this while our staff was having mandatory furloughs and fear and anxiety for themselves and coming face to mask with a disease that is as harmful as COVID-19 is, was a tremendous challenge. I'm going to pivot to another question, and then we'll work in reverse order. So me, George, Dick, and then Kara. Is what would you envision out of all of this sticking? What lessons did we learn that moving forward in your practice, you think you will carry forward? And so the two things that come to my mind, and I'm going to pick up on something that Dick had said, which is how validating this experience was for the things that we know lead to good cancer care. So I think what I heard you say is you understood even more how important your approach is with patients when you couldn't do it. It became that much more obvious of how useful a tool human contact is, and you really come to understand it when you can't do it anymore, of how critical it was. So that was one thing I see sticking. And the second one, which is a little less emotionally, impactful, is the impact that technology has had on our entire workflow. In medicine and pediatric oncology, we've been dancing around issues like telemedicine and virtual meetings for a long time. And COVID-19, I think, was a big giant bully that just pushed us into the pool and made us all try it. And moving forward through this crisis, our practice has been able to connect at a much deeper level with our surrounding community, our surrounding hospitals, and we've more frequently engaged in virtual meetings, virtual tumor boards, connecting with other colleagues for really tough cases. And I envision moving forward that we will continue to do so. I will turn this over to George and kind of get his reflections on moving forward, lessons learned, and what's going to stick from all of this.
Well, David, I agree with you completely about using technology. I think certain aspects of telemedicine, certain aspects of meeting virtually are with us to stay. And there are pros and cons of that. Obviously, it's great to be able to meet this way without driving. On the other hand, I miss having a cup of coffee with Dick and talking about something on the side that might lead to a collaboration down the road. So I think we don't want to rely too heavily on technology. And the same is true with interacting with patients. Obviously, it's great for them to be able to get a medical opinion virtually, but it's not the same as being face-to-face. And it's harder to provide care that way. We've also learned that certain aspects of clinical research can be done remotely, and that patients can get studies done, at the local hospital. They don't really need to come and visit with us. I guess the final point I'd make is that I am noticing that patients and the public has learned more about clinical trials and about the immune system, and certain things that I used to have to explain in depth, a lot of folks understand better now. And I think that's going to cut both ways for us. But I think talking about why we do clinical trials, people have been reading about COVID trials and what they mean and how they're interpreted. And so the public is educated in a way that they weren't before.
Wonderful. Dr. Deming.
Yes, first of all, I agree with everything David and George said. In fact, David, you probably hit on the first two, and I won't repeat them, but clearly telehealth, we're the same way. We're dabbling with it, and then we're all in, and that's not going to change. And second, Zoom meetings. So I'll touch on something that others might not bring up, and that's workforce issues. I think COVID certainly accelerated what we're probably going to experience with those of us baby boomers that are retiring. we are now seeing individuals in their 60s who might have thought that they would, how could I do something that would provide me more joy than being in healthcare? And maybe I'll work to 70, even though, I don't need to for financial reasons. And now we're finding that it's just so much stress that not only is the 60-year-old super experienced nurse not going to stay to 70, she's not going to stay to 65. And so we are now looking at how do we address workforce shortages that are here with us and are probably going to get worse in the next few years. So just in the realm of nursing alone, what is it that we require our nurses, especially you go up on the floor, I just feel, I want to start emptying bedpans and doing things because they are so torn between being understaffed and wanting to do the right thing. So one of the things that we're doing at our hospital is creating a virtual nurse. So I thought when we were doing this, well, it's to maybe just have a face go with a voice when you answer a call button. But no, it's to provide a very experienced nurse with a video screen in the room that can help the novice nurse get through her job with greater degree of confidence and assurance. Somebody just out of nursing school doing their first code. I mean, to have an experienced nurse's face and voice to help talk her through, just one example of how can we use our nurses on the floors, and you could say any one of the caregivers, to the best of their abilities to allow them to do as much as they can with the support so that they don't end up getting burned out even faster than those baby boomers that are kind of leaving the marketplace early.
Thank you, Dr. Deming. You reminded me of an article that I read recently that addressed this issue and said in 2021, people are starting to think about their work as something they do, not somewhere they go. And that's kind of a short, brief way to say kind of what you're saying. We have to kind of rethink a lot of things moving forward. Kara, your thoughts about things that are going to stick?
Well, first of all, ditto to everything that's already been said. Telehealth down in southern Iowa with slow Wi-Fi speed and a rural health clinic, which gets reimbursed differently from Medicare for telehealth visits. And the population is an older population down here and doesn't have as much technology as is available in other areas. So we had some barriers to that too, along with the most important, that it seems impersonal to do a visit over a Zoom meeting. As well, I do want to tie back into the visitor issue. We chose not to wax and wane when there were probably a year ago now, when it was kind of determined what you should do regarding if it, proportionately to the percentage of positivity of COVID in your county or community, right? And we were just not going to turn off and turn on the valve for visitors, and now you can and now you can't. We were going to be very strict about them. And currently we still are. Our chemo patients and their family members utilize our cafeteria and other areas in our hospital. Well, in Corydon, Iowa, our cafeteria is also a restaurant for the community. So we shut that off over a year and a half ago now, and it is still not shut back on because we are very protective of who comes into our facility. So those are ongoing. We have had to learn how to manage patients on vents in a 25 bed critical access hospital, because when calling for a helicopter to come and get our patients and take them out, we have been told the helicopter is not coming. There's no way, nowhere for these patients to go. We don't have separate wards at Wayne County Hospital. We have one big med surg ward, and the chemo infusion room is right off of that ward. So trying to block off a COVID unit, we did that as far away at the other end of the med surg floor to get them away from our chemo infusion patients. So logistically, we've done that. We have since gotten rid of our trailer. We had an area of our facility that was down to the studs. It used to be a educational space for Indian Hills Community College some time ago. And then we invested the resources when the resources were rare and rebuilt and extended our primary care clinic. Well, having been able to do that, we were able to separate off a separate entrance and separate rooms for infectious or ill patients. So we carried over our trailer idea, and now our walk-in clinic and primary care clinic has a separate entrance, separate rooms, and a separate provider for any ill patients or infectious patients. And we know that there was very little influenza last year as because of everything we were doing to mitigate COVID. And so our thought was, what if we do that going forward? What if we contain RSV, influenza, COVID, and we contain that in one area so that our healthy patients and our oncology patients and our staff and the rest of the hospital would not be quite so vulnerable. I could talk forever, but those are about the few of the highlights of things I can think of.
Thank you. And we have 2 minutes left, and I know that Kelly does an awesome job at running a very tight ship. So we have 2 minutes left, and I'm trying to think of one of the most useful questions for a distinguished, mature, experienced group like we have, and what I would want to know from the three of you. And I hold myself as no exception. The COVID-19 pandemic has created loss probably for every human being on this planet, ourselves included. And in our roles as leaders, people see the side of us that we need to project in our roles: calm, controlled, thoughtful. However, we all are human and have experienced undoubtedly loss for ourselves, loss of things, events, time spent with family or people that we love. And so I just want to take a minute with all of the cumulative wisdom around the table to ask how you all have managed that for yourselves and continued to conduct your work, offering yourselves in service of others while you walk around with those burdens. How do you advise people to deal with loss in their lives and keep moving forward?
Well, I'll jump in, and I think Dick's purpose in life speaks to it. Having a mission, having a purpose. That if you're busy serving others, it's easier to handle your own pain and your own concerns. And by focusing on what you can do to help, it really helps lessen the pain. And I lost my best friend from high school. Had both cancer and COVID during the pandemic, and I was unable to attend the service because he was out of state. And by focusing on what I could do here, helped me deal with that.
Thank you for sharing. I know I should have thrown a trigger warning out there, and trigger warning.
So I would say that we all are better if we reflect on what brings us joy. And obviously I'm talking about Aristotelian eudaimonia, the joy that comes from a life well lived. And if we know what brings us joy, how can we live our life to bring more of that into our lives? It's something I talk to my patients about a lot, especially my patients with incurable cancer. How in the face of incurable disease do you find joy and bring joy to others? And I would say that one of those things, two of those things for me that I share with my patients are being in nature and poetry. And can I take 30 seconds to share a poem that means a lot to me during this time? This is a poem by Wendell Berry called "The Peace of Wild Things." When despair for the world grows in me, and I wake in the night at the least sound in fear of what my life and my children's lives may be, I go and lie down where the wood drake rests in his beauty on the water and the great heron feeds. I come into the peace of wild things who do not tax their lives with forethought of grief. I come into the presence of still water, and I feel above me the day-blind stars waiting with their light. For a time, I rest in the grace of the world, and I am free.
Thank you, Dr. Deming. That was very inspirational. I am not familiar with that poem. Viktor Frankl would be very proud of your comments. For those unfamiliar with Man's Search for Meaning, that's very, akin to what is advised for people who are experiencing suffering. Kara, I don't know if you're brave enough to follow that act. It was such a powerful.
I know, Dr. Deming, I should have gone before you. Kelly, I promise I'll make it quick. And I can totally relate to Maria's experience as I became a family member of a cancer patient during COVID. My mom was diagnosed with Waldenstrom's non-Hodgkin's lymphoma. And I, as an oncology nurse, was kept out of the chemotherapy room because there were no visitors. I couldn't be with my mom when I really needed and wanted to. That was very hard for me personally and professionally. And then after being diagnosed and being more vulnerable in that position, then we couldn't have Christmas or Easter together. So, and in there somewhere, my son got married, the first grandchild to get married. Not everybody could make it. I'm a nurse, obviously. My sister's a physician's assistant. My sister-in-law is a nurse practitioner, and we refused to get together at mom and dad's for everything we could have been bringing into that environment. But I am very Pollyannic and I am very optimistic, and I've been that way all my life. And I believe there is always good that comes out of evil and good situations that come, but I think you need to look for them. So our Zoom Christmas of not being together was interesting. It was fun in a different way, but it also brought together family members from Washington State, Utah, and Germany that would not have been able to join us for Christmas in person anyway. And we would not have been able to get together with those people. So I think it's important every day to find what you're grateful for, even if you have to dig for it sometime, and focus your joy and your inner spirit on those things.
I want to thank the panel members again. I get to divert the attention away from my personal story, which is extensive, because I owe Kelly 4 minutes. So maybe Kelly next year at some future meeting when we're in person. I totally get why George likes having coffee with Dick Deming, and I can't wait until those days occur for me.
You're officially the keynote next year. We'll hear your story.
There you go.
Great.
Thank you, everyone.
Thank you.
Thank you all so much. We appreciate your vulnerability a lot. And that's such a wonderful way to wrap up the membership portion of today. We have a really inspiring keynote as well to close us out, but just it's so great to hear from our colleagues and neighbors about your experiences. Thanks for your knowledge and wisdom and your vulnerability. Appreciate it. And I'm pleased to introduce, I'm actually just going to kick it over to board member Cindy Feaster, who's going to introduce our final speaker. Cindy, thanks for being here.
Yes, thank you for having me. My name is Cindy Feaster, and I am the Chronic Disease Coordinator at Lynn County Public Health in Cedar Rapids, Iowa. My pronouns are she and her, and I am thrilled to introduce our closing speaker for the Iowa Cancer Summit, Danielle Ripley-Burgess. Danielle Ripley-Burgess is a 2-time colorectal cancer survivor, first diagnosed at age 17. She is part of the growing community of early onset survivors facing the disease well before the age of 50. Danielle's personal story has been told around the world in outlets like the Today Show, BBC's World Have Your Say, Sirius Radio's Doctor Radio, the Chicago Tribune, and others. Danielle's a published author, blogger, and columnist for Cure magazine. Danielle also serves as the chief storyteller for the national nonprofit advocacy organization Fight Colorectal Cancer. She's the editor-in-chief of the magazine Beyond Blue, and as a PR strategist, She has helped lead award-winning campaigns and projects that have secured national media coverage. She's built partnerships with strategic partners and reached millions of people during March, which is Colorectal Cancer Awareness Month. She resides in the Kansas City area with her family, and you may follow her on social media at Danielle is B. Everyone, please welcome Danielle.
Hi, everyone. Well, thank you so much for having me. And can you guys hear me okay? I want to do a sound check before. It's so weird not being able to see your faces.
Can hear you great.
Okay, and I'm going to share my screen. And so are we good? All the tech working? Okay. Well, thank you so much for having me. I am smiling. It means a lot to be able to share my story with you, and especially because you guys are from Iowa. And although I am from Kansas City, Missouri, born and raised here, Iowa is very close to my heart. I was actually in Dubuque around this time last year. I was reflecting. I did a personal retreat in Dubuque and went through the Field of Dreams on my way home. And then my stepdad, he's from Fort Madison. My stepmom's from Sheldon, Iowa. And then my brother actually lives in Indianola, just south of Des Moines. So I have lots of Hawkeye fans in my family. And I promise it, I actually was like, this is ironic that I chose Hawkeye colors for this slide. So I promise it's kind of ironic, but maybe it's just even a little light to get us started. And I actually think this is really neat transition, because what I wanted to share today is not only my story, but how I have found resilience through all of this. And I was listening to the conversation before this. And so hopefully it's just another good segue into carrying on those themes of finding joy and staying resilient and finding gratitude. So just briefly, a little bit about my story. Like the introduction mentioned, I was diagnosed when I was 17 years old with late stage colorectal cancer. But where I like to tell my story actually is flash forwarding a few years before all of this happened. And I think this picture is a good launching point. This is me and my best friend, Emily, from junior high. And this is right before our first big dance. And we were so excited. We'd never really gotten dressed up like this. We had high heels on, we got to put makeup on. And while our faces are smiling on the outside, there was actually a different story going on with me on the inside. I was really anxious. I was, in early adolescence. So I was a young girl and I did not feel comfortable about my body. I was pretty terrified of just all the changes that I was going through. And actually about a year before this picture was taken, I had taken a big stand in the store when I was with my mom, and she wanted to buy toilet paper because in the midst of everything else going on in my world, one of the worst case scenarios that I could think of was that we were at the store and my mom's buying toilet paper and everyone in the store would see it in our cart and know that not just my family pooped, but I pooped. I could not deal with the thought of that. And so we had this legit fight in the middle of the aisle. I wanted her to take it out of the cart. She didn't, but then I was like, fine, I'm not carrying it out of the store. And after that, I actually refused to go to the store with her anytime toilet paper was on the list. I share this story and I often say my story starts in the middle of a toilet paper aisle because a year after this picture was taken, when I was toward the end of my 8th grade year of junior high, I started seeing really small specks of blood in my stool. At first, to be honest, I thought I'd maybe started my period. Wasn't sure what I was seeing, but then a few days after that, I realized, okay, that's not what's happening. And then I started thinking, well, maybe this isn't blood after all. Maybe these little red specks I'm seeing are food. Maybe I'm eating too many Twizzlers, or maybe the pizza sauce on my pizza, or Hot Pockets, or maybe it's strawberries. So I went on this no red foods diet for a while, thinking, okay, I'm gonna try and fix this on my own. Again, I'm 8th grade here, and nothing seemed to work at first. Maybe it helped, but nothing seemed to really help. And so shortly after that, I finally was like, okay, maybe I should ask about this. So I went to my mom and I said, hey, could you look up, the internet was relatively new at the time. And I said, could you kind of look up, sometimes I think I'm seeing a little bit of blood when I go. Number two, I didn't give her many details because I'm still pretty anxious about everything that has to do with my body. But I did say something might be going on. It doesn't seem normal. So she looked it up online. Everything that we found seemed to point to hemorrhoids, which made a lot of sense because I played volleyball. I was pretty active. I wasn't seeing that much blood. And I was like, okay, great. I have hemorrhoids. End of story. So I thought I had hemorrhoids, and then I thought the hemorrhoids actually followed me all the way into high school. So as I went through high school, I was pretty normal high schooler, involved in theater and volleyball and things like that. But my junior year of high school, things started getting worse. And this little bleeding problem that I'd become pretty accustomed to, it was actually normal for me to see blood every time I'd go to the bathroom. All of a sudden, the blood started getting worse and worse. And it got to the point where I couldn't brush it off as, okay, this is minor anymore. But the problem was, not only was I still kind of insecure about my body, but things at home weren't the best between my parents. And I really didn't feel comfortable confiding in them. I didn't want to be one more problem into their world. So I just kind of kept it to myself. Except as the blood picked up, the color changed. It went from bright red to dark red, sometimes black. And then the amount of blood started to become pretty concerning. So after a while of that, I started to get scared. And I was dating a guy, we were really close, and I didn't give him details of what I was seeing, but I did say, I think I maybe need to see a doctor in the near future. I think something's wrong with me. And that's all I said. Fortunately, he picked up on what I was saying and he started pestering me. Did you see a doctor yet? Did you see a doctor yet? And during one of the times he was bothering me, my mom overheard him. And all of a sudden she was like, wait, you are still having those problems you mentioned a few years ago? And I was like, yeah. And what I liked, long story short, I basically feel like I got busted for bleeding out of my rear. They rushed me to a GI. Fortunately, he did not hesitate to sign me up for a colonoscopy as soon as possible, even though I had just turned 17 years old. I was really young. He rushed me in, and that colonoscopy ended up saving my life because during it, he found a large colon tumor that tested to be stage 3 colorectal cancer. We were in total shock. Nobody in my family had had colon cancer. Come to find out later, my great grandparents had had it in their later years. So nothing would have ever flagged a concern as far as somebody younger in my family getting it. It felt like it was completely out of nowhere. And not only were we shocked, but doctors around the country were just kind of beside themselves. We ended up going to MD Anderson for some second opinions. They sent my stuff around the country. And most people had never seen somebody my age with this disease. Fortunately, everyone did agree on treatment. And so I was able to do treatment at home in the Kansas City area where I was most comfortable. I had pretty aggressive treatment because they wanted to hit it hard. They were so scared they'd never seen this in somebody my age. So I had surgery, I had chemotherapy and radiation. And the picture of me in the red dress is actually me in the middle of all of this. So this is my prom picture from junior year, and prom kept me going. So in the midst of all of this, I had that to look forward to. The doctors were willing to kind of work around that schedule and make that a priority. And so I was able to go to prom, and honestly, this was a crazy 6 months of my life. And so I was diagnosed in January of 2001. And in July of 2001, I was told, okay, you're in remission, you're cancer free, have fun, go on with your life. And I was like, cool, I did. So I ended up going back to high school. I finished on time and I graduated high school. I went to college. I went to college with some purpose. I was like, I commend all of you who work in the medical field, because after going through this, I was like, I don't think I could do this. So I didn't pursue medicine in light of my cancer experience, but I did pursue nonprofit work. And so I had the goal of working for like the American Cancer Society or kind of somebody like that one day, because I loved communications. And so I was like, I want to give back to cancer in that way. One day I want to go into like public relations and communications. So that was my major. It was PR. I got married to that boyfriend who kept nagging me to see the doctor. We ended up getting married and I started a career in advertising, and I was on my way. I thought, you know, what a fluke. What a crazy thing to happen to me when I'm a teenager, when I was 17. And as the years went on, that just became something that was very much kind of part of my past, but I didn't think about it a whole lot. But I was put on a pretty aggressive follow-up schedule as a survivor. And I'm really thankful that I was put on a pretty aggressive follow-up schedule, because during one of those years, about 8 years after I was diagnosed, I went in for a routine colonoscopy. I didn't have any issues going on. I had no reason to think anything was wrong. But when I woke up from that procedure, my GI looked at me with somewhat of the same look that I had received 8 years prior, except he said, you know, I found something. I think you have a polyp that's probably it's concerning. I did biopsy it. It ended up coming back as benign, but he said, Danielle, I think your cancer is going to try and come back. And so he recommended something pretty extreme at the time. He said, I want you to have a subtotal colectomy, which basically I had a section of my colon removed during my first cancer. And he said, I think you need to take out the rest of your colon, except we'll leave 13 inches. So you don't have to have an ostomy bag right now. And he said that way, less colon to scan, less risk your cancer is going to try and come back. So it was a lot to take in, and I thought about it, and I went ahead and proceeded with the surgery. I said, okay, I'll have it. And when I woke up from that surgery, I saw more concerned looks. And because during that surgery, they got a better look at the concerning polyp, and it was determined after pathology reports came back that it actually had turned malignant. And so here I was 8 years after what I thought cancer was a fluke of my teens. I'm sitting in a bed, hospital bed, 25 years old, just had most of my large intestine removed. What I thought was preventing cancer, being told I have cancer again. And, you know, I've had a lot of people ask me over the years, you know, well, that must have been so much easier. You know, it was stage 1 and you didn't have to go through the chemo and the radiation like you did, you know, when you were younger. And I'm like, actually, that was harder because I think not only was I older and I was able to process what having cancer means, I wasn't, you know, in my teens anymore, but all of a sudden I had to go through this major acceptance process of what it means to allow to have cancer as part of my life forever. I eventually learned I have Lynch Syndrome, which is a genetic disease. It's pretty common in a lot of these young onset patients. You may be finding, like me, with colon cancer way too young, too young. My case is really rare because I did not inherit Lynch syndrome from a family member. Usually that's the case, but I'm actually the first patient in my family to have the bad gene. So this has been quite an acceptance journey for me. To give you, it's always hard to put to words, you know, the anger and everything of what I've gone through. But the cool thing is that writing really did help me. And so I started a blog shortly after my second diagnosis, and I just started writing to process like everything that I was dealing with and all the colon issues and the bathroom problems. And then that writing kind of turned into some awareness. So I found some purpose of helping other people. And as I was doing that, I also found the advocacy groups. So the first group I found was the Colon Club. They're a group of young patients with colorectal cancer diagnosed under age 50. And actually the Colon Club is how I'm connected to you guys. I don't know if anybody knows David McCluskey. He's also a colon cancer survivor that was part of the Colon Club. And I met him through that. And he's who introduced me to Liz and Rachel. So small world. But the Colon Club really helped connect me with some people to help me process everything that I was going through. And then that also connected me to fight colorectal cancer. And we're a national nonprofit full of advocates, and we really focus on policy and research and helping just improve patient lives. And so connecting with Fight CRC gave me just a lot of peace and hope and purpose for everything I'd been through. To give you some perspective, so that first picture on the left, that's me in the red dress. This is 2001. So, this 9 months after I was diagnosed, 9/11 happened. So that's kind of the time frame we're looking at. And so this is my story over the past 20 years of living this out and continuing to go. And so I have learned a lot over these years. And one of the themes that I have learned is probably resilience through all of this and how to keep going. And my hope in sharing my story with all of you guys is that not only will it inspire any patients on the call to find resilience and show, okay, 20 years later, after all of this, here I am, I'm still doing well, I'm still smiling, keep going. But those of you fighting this professionally who feel like you're in this relentless battle of this won't give up, hopefully this will bring inspiration and encouragement to you as well. So I want to talk a little bit about resilience. And when I was thinking of this clip came to mind. My family's really big Marvel fans. And in the recent movie Black Widow, it opens with this scene where these little girls are playing outside, and the little girl, one of them falls and hurts her knee. And the mom comes out and says, "You're a brave girl. Your pain only makes you stronger." And then I'm going to play this about what happens next.
Yeah, you know what? Those are actually part of the Lepidurity family. The glow that you see, that comes from a chemical reaction called bioluminescence. Come on, time for dinner. Bioluminescence? That's right. Dinner! Come on, dinner!
Okay, so that's a short clip, but I love it because these little girls learn about bioluminescence. Their mom's a scientist. And I looked into bioluminescence a little bit more because I was like, what is that? And so it's when bugs have this chemical reaction that make them glow. And this is a phenomenon. I didn't know this, but like Aristotle, Darwin, the NASA, the US military, they've all studied this phenomenon of bioluminescence. People even think that humans have some components of this where like our skin kind of glows. And what I loved is this concept of, bioluminescence is things lighting up in darkness and things glowing when you need some light. And so while this applies to bugs and science and nature, I was thinking, actually, I've seen a lot of bioluminescence over the past 20 years in the cancer community. And I've seen a lot of people who have helped not only light up that space, but people who have taught me that, my pain can only make me stronger. Some of those lights, I mentioned my husband, now boyfriend, that's the picture on the left. That's him. He stayed by my side. We've been together 21 years, married 16. So he's one of those people who's just lit up my life. The picture on the right is my nurse, Kim. And I included her picture because a lot of you guys work directly with patients, and I don't want you to ever underestimate your role in their life. And anytime I think about who was a light in my life, like who has helped me in some of these darkest days, especially back then, Kim's unfortunately passed away, but she always comes to mind. She would slip me brochures about wigs when I was told I'd lose my hair. Kim went out of her way to find a scholarship for me for young cancer survivors when I went to college. She showed up for anything she could. She came to my wedding. And so when I was in such a dark, hard place, Kim always pops in my mind as somebody who has been there for me. More little fireflies. On the picture on the left is actually my current team. I'm a patient at the KU Cancer Center, and they have a young adult survivor transition clinic. That's a mouthful, but it's been really helpful for me to transition my care to a clinic dedicated to survivorship, and especially for survivors like me who were diagnosed really young. And so this is my nurse navigator and my doctor, and they're holding my book. I published a book last year with my story, and they've just championed me and come alongside me and have been lights in the midst of all of this cancer stuff. Angie Davis is on the right. I don't know if you guys know her. She's the president of Fight CRC. And I included her because she is so funny. She makes me laugh all the time. And so while we deal with really hard, heavy things in this cancer world, she's always bringing levity to it. And then the last picture, the last people who popped in my mind of lights in my life are my cousins, Christy and Nikki. And actually, I want to talk a little bit more about them because Nikki is actually who inspired this talk and just even kind of what led me to be here today. Nikki could best be described as my cousin Eric's love of his life. So in the prior picture, my cousin Christy and Eric are related, and Nikki's technically my cousin-in-law. And in November of 2018, she was diagnosed with triple-negative breast cancer. It was a shock. She was early 30s. It came out of nowhere. She had 3 young kids. She and Eric had 3 young kids. She was a runner, beautiful garden out back, strong in her faith. And we were all just blindsided. And something that's happened to me a lot over the years is when you're a young survivor who face things like this, I'm usually one of the first calls they make. So Nikki called me and we just started going through it together. And we talked through her treatment, and I'd help her process all of her fears. And she was so scared. And how do I talk to my kids? And she was really mad at God. So we had all of these things that we'd process through. Unfortunately for Nikki, she made it to a point where she was declared cancer-free and she had reconstruction. And this photo is taken then in 2019, right when she was kind of going in for a reconstruction. And unfortunately, though, in September of 2020, her cancer returned. And at that point, things got really serious, and the words like terminal were thrown around. And so that was about a year ago. And Nikki indeed she got 1 more year to live. Last Tuesday was a year since Nikki, last Tuesday was 1 month since Nikki passed away. So she passed away September 12th, about a month ago. And I actually took this picture from her home. This was a phrase she said all the time. And so they had it mounted in their home, and she would always tell her kids, be the light. And every time she went in for treatment, that was her mantra, is I'm going to be the light. And I'm sure a lot of you guys have met patients like Nikki where they just light up any room they're in. And so in honor of her, kind of dedicating this talk to her, she's inspired me to keep being the light and passing on this message to all of us. And the reason I wanted to share this story, I'm sorry if it's a trigger warning, I should have used that wording earlier. The reason I wanted to share this piece of Nikki's story and my story is this is our reality. You guys know this, you're working in this day in and day out, is that, I'm not trying to be depressing or sad, but this is really what we're dealing with. On top of a year where we've had COVID and we've had racial tension and we've had political elections and everything that brought. And now we have these mask versus no masks debates, and we've got the vax versus no vax debates. It's like there's so much going on for us. And then on top of that, we throw cancer, which is like life and death stuff happening all the time. And so now more than ever, it's this plea for resilience from all of us who are in the community, whether we're patients or providers. And while it feels like it's really heavy, I do feel like there's always hope and there's always light. One thing I wanted to point out, I wanted to be careful to also mention I'm one story out of many. And I wanted to just touch on this, there's a lot going on, and several people have surveyed patients and providers to kind of get their pulse. And I was kind of curious, like, what are some of the studies saying as far as what people are going through in the cancer community in light of kind of the past year we've had. And Fight CRC did a survey, about 222 patients chimed in. And here's a few things they found. Like 40% of people said they had disruptions in care. They didn't know when they'd be rescheduled. Their visits changed to telehealth. You guys know that. I heard you talking about telehealth earlier. Majority of 222 people said they feel nervous, anxious, or on edge, concerned about getting COVID. They feel isolated. The survey asked lots of different kinds of questions, but mental health and anxiety were definitely prevalent themes. Here's a few things patients said. I was anxious about losing benefits, losing my health insurance. There was one night where I was having a panic attack because of COVID and not being able to go outside. Every time I would go to my treatment, there are multiple COVID patients there too. I was scared of getting sick. Another patient said, when COVID-19 got here, I remembered, because I'm high risk, how I felt when I had stage 4 diagnosis and was going through treatment, knowing it was quite possible I was going to die. It brought back the whole situation. So lots of triggers going on in the patient community. I felt them, my peers have felt them. Again, Fight CRC is one small subsect of a bigger cancer patient community. But I know cancer patients aren't the only ones facing it. Most of you probably fall into this category of providers of some sort. And Mental Health America did a provider study. 1,100 people filled out their survey. And here's some things they said they found. Providers are stressed out, stretched too thin. They're worried about exposing their loved ones. Providers are reporting emotional and physical exhaustion. It's the most common answer for what they're going through. So the people caring for the sickest patients are having trouble sleeping, physically exhausted, dreading going to work, changes in appetite, headache or stomachache, questioning career path, compassion fatigue, heightened awareness or attention to being exposed. A lot of them are saying they're not getting enough emotional support. And then some of them who are parents are saying they're lacking quality time or unable to support their kids as a present parent. So I'm looking at all of this, I'm stepping back, and I'm like, wow, if I had to describe how I have felt the past few years, how my peers in the cancer community say they felt, and what I'm reading these surveys saying that patients and providers are feeling, I think the best way to describe it is maybe we could all say, like, we have been on the struggle bus and it doesn't feel like we are quite off of it yet. However, in light of a talk about just having hope and resilience, one thing I just kept coming to mind of what I wanted to point out is this really simple fact is you are here and I am here today, and this totally matters. And so it was really not lost on me, as I was preparing for this, I was like, you guys, you're an incredible group of people working for cures for cancer in the state of Iowa, and you've taken time out of your busy schedules to log on to a virtual conference, second year in a row. We're doing this through Zoom. On a Friday afternoon after a long week, you're still here for a presentation from a gal from Kansas City who survived colon cancer twice. And even what you're doing today is an act of resilience. And when I think about resilience, I think sometimes it feels so big. Like, how do I have resilience to face all of these huge things? And how do I keep going? It's like the weight of the world is on my shoulders. But actually, the first step toward resilience is actually recognizing the really small things in your way. And so right now, it's just a simple act. You're being resilient by just being here, right here, right now. I want to talk a little bit more about resilience because I think it's just really cool and really important. And one of my favorite definitions of it is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. And I think all of us in the cancer community, whether we're here as patients and caregivers or whether we're here as professionals, I think we all know that we have to have resilience in what we do because we will not last long without it. when I think of resilience, my friend Jamie Ayton often comes to mind. This is a picture of Jamie. And something that's interesting about his story, he has such an interesting perspective. So Jamie is a disaster psychologist, but he's also a stage 4 colon cancer survivor. And before Jamie was diagnosed with cancer, he would go to natural disaster zones and survey people and help people, help survivors through their mental health. And he would do a lot of research. So he actually survived Katrina himself, but he goes into like post-hurricane, post-tornado, gun shooting. He studied Ebola. And so that was his experience before cancer. And when he was diagnosed with cancer, he found a lot of common themes between handling and surviving natural disasters and surviving personal disasters. And that actually has since guided a lot of his research and work. And so now he studies things like resilience and fortitude. And about a year ago, he did an interview with the Frankly Speaking show through the cancer support community. And he had a really interesting comment. And so I'm going to play it for you guys right now.
You said that you had come to realize that a person can be strong even when they feel weak. Can you explain to us what you mean with that statement? You know, there's a lot of language that we use about maybe we're fighting cancer or battling cancer. And quite honestly, through a lot of my experience, I struggled with that because I felt like everything was happening to me and I felt weak. But then as I went through that process, doing some research on not just resilience, but this idea of fortitude, and realizing that endurance and perseverance is also a sign of strength. So it helped me to reframe the way I thought about what strength and power meant.
So I love Jamie's quote because he kind of gives us permission to reframe how we think about resilience. And he mentioned words like perseverance and endurance. And essentially, you know, it's like resilience isn't the person who goes and runs the marathon or the person who works the longest hours, or as a patient, you know, the person who's had the most cases or had the most chemo rounds. Sometimes I think we can think those are the people who are resilient. And yes, they are resilient, but a lot of us are also resilient just by enduring. And I think endurance these days, it can start small. I mean, sometimes enduring is going to work. It's continuing to show up for appointments. If you're in my area, it's continuing to put on the mask so you can go into the store and buy your groceries. So resilience is endurance. But I think in order to endure, you always have to have inspiration. And so one question I was going to pose to you guys as something to think about and jot down a few names is, if I ask you who inspires you to endure in your line of work, who would you say? Like what patients or what colleagues or what people in your life or what things in your life help you keep going? Maybe when you're on the struggle bus, who helps you continue to keep showing up every day to do what you do? And I want to give you a second to kind of think about that. And I want to share what came to mind when I asked myself that question. And like I told you guys, this is pretty fresh and raw as far as losing a family member a month ago to cancer. But they immediately popped in my mind as far as people who are enduring and people who are enduring well. And carrying on the theme of find the light, I just love what my family has been able to do to honor Nikki. So the picture on the left is actually her grave. And over the past few weeks, they've decorated it for fall because she loved fall. And then they found a solar powered light that, you know, soaks in the sun during the day. And at night, that little lantern glows by her grave as an honor to her and her message of find the light. And then they bought the same lantern. And then the picture on the right is that lantern hanging out by her screened-in porch. And so Eric, my cousin, and her 3 kids now see that every day and every night. And while their mama is no longer with them here, her presence and her encouragement to keep being the light remind them. And this small little lantern is helping keep my family going through unspeakable pain. And the reason I wanted to share this with you is endurance isn't necessarily finding this peace about everything going on. You know, my family's not okay. Like, they are still hurting, and they have faced the biggest blow of their lives, and they're angry. They've not found the silver linings yet. And I think it's important to recognize that sometimes that's what it's like. Resilience isn't all of a sudden finding this massive purpose for everything. You know, I think in light of COVID, you know, we're not sitting here yet going, oh, this is why we just survived a global pandemic and had to change everything. But resilience is truly finding a small way to just make it to the next day and the day after. And what I think is really important for all of us, whether you know, your career is in cancer as a professional and somebody working with patients, or you're a patient in this world or patient advocate, is, you know, we are the people they turn to for help. And so for me as a patient, they're turning to me for advice. For you guys as experts, people who help treat their cancer, give them treatment, give them resources, they're turning to us for that kind of endurance and light. And so we have to make sure we know how to find our hope and our light so that we can encourage them to keep going, and we can encourage them to keep enduring. And so I was asking myself, well, how do I encourage you to do that? And I actually love some of the things you guys said before I started chatting, like the beautiful poem that was read. And I heard somebody mention finding small joys in the moments. And I think all of those ideas were just so beautiful. And one idea that popped in my head, and I also heard this word, was gratitude. And I will say that when I feel like I'm surrounded by darkness, when I feel like I'm surrounded by fear, I'm on that struggle bus, it feels like things will not let up, the news is not trending in the way I would hope, one thing that will help me find little lights and things truly is gratitude. When I was getting ready for this, I was just kind of looking around, like, what are some studies on gratitude? Because I think we all know it's good for us, but I was like, how good is it for us? And so this was a really interesting one I found at Indiana University. These two guys looked at groups of students who were getting counseling support from the on-campus psychiatrists. And they actually randomized some students into 3 different groups. So they were all getting counseling support, but one group, in addition to that, was asked to write 1 letter of gratitude once a week for 3 weeks. The second group was asked to write down their deep thoughts and feelings about negative experiences they'd had. And then the third group they were not asked to write anything. They just went to the counseling appointments. At the end of this study, by far, group 1, the one that wrote letters of gratitude once a week for several weeks, had significantly better mental health 4 to 12 weeks after their writing exercise ended. And what I loved about this particular small little study wasn't just that it showed how gratitude can really help in general, but help mental health, but how it does have a buildup effect. And so even if offering gratitude in this moment doesn't make me feel better instantly, a gratitude practice, something that steadily is building ways to find the light, to find good things, eventually will add up, and it really will have a powerful impact on mental health. Now, this picture is a picture of this mug I got from my friend Bunny. So my Bunny is also a stage 4 colon cancer survivor. She wrote a book on her story, and since then she's launched a podcast, and her whole message is life-saving gratitude. And so I love it. She inspires me a lot to just keep finding the joy and finding what we're thankful for. And she had me on her podcast a couple of months ago and said, Danielle, how do you practice gratitude? And it made me really think about it. And so I thought, you know, there's actually kind of 3 ways I probably practice this on a regular basis. The first is a full page of notes. Now, I haven't done this lately, because I am raising an 11-year-old daughter and I have a 3-month-old foster baby at home with us. So I can't do this right now, but a few months ago, before the baby came, I was taking a whole page, a whole journal, and I would fill the whole page, every single line, with what I was thankful for from that day before bed. And I made myself do that for months on end. And that forced practice really did help me start to appreciate and recognize things throughout the day to be thankful for. Another thing I've done lately, it's been a hard road to foster care. That's not what this talk is about today, but it's been a hard year in addition to everything. And one thing I started doing this summer when things were really tough is I started writing letters to people who have been helpful in the process and just being grateful for their role. And so even though I'm not filling out these pages of gratitude, just even like a simple letter, kind of like they did in the study, has helped me. And then even when I'm not able to sit down and do the letter, I found I'm a person of strong faith, even just pausing at a stoplight or when I'm waiting for my groceries to be put in my cart, as I just offer gratitude for that moment. And I just really intentionally pause and think, I'm so thankful that my car is running right now. I'm so thankful I had money to buy gas. I'm thankful for the technology that allows groceries to be put in my cart and I could order them through my app. And so it's finding small little things like that, you know, finding the small things to be thankful for, even like the conveniences, helps me cope and helps me keep going in the face of like really hard, big things, like constantly facing my own cancer experiences, losing family members to cancer, and then all kinds of unsettling things happening in other family members' lives and in culture of today. So gratitude is what I would say has been key to helping me find resilience, kind of back to that theme of bioluminescence I mentioned. It's, you know, I truly believe both science and faith point to something we can hang our hat on, is that bioluminescence, things will glow in darkness. Like we can find light in darkness, and gratitude is definitely the way to find it. And like I said, I've been in this world for 20 years now, and I can kind of relate to some of the stories we heard last month from 9/11, where it's not as fresh as when it happened, but the after effects still linger. And how to cope with those after effects has been really pivotal for me in finding purpose and meaning. And gratitude has been really key for that, and it's helped me keep going. So to close, I'm going to offer you my gratitude list of this moment. I've been so grateful for my family and my support system. I'm so grateful for small little things like red lipstick and fall weather and fall baking. I love to bake. Today I've been so thankful for the advocacy platform. I have shameless plug. I think it was mentioned earlier. I am the editor of Beyond Blue magazine, and we just dropped our fall issue today, and it's the food issue. So if you guys are looking for a good patient resource, especially for your CRC patients on food and nutrition, go to fightcrc.org. You can download that. And last, I'm so grateful to be here with you guys today. You are heroes. And I believe all of you guys are lights in this cancer world. So thank you for having me.
Thank you so much for sharing your experience with us, Danielle. It has been an absolute pleasure to hear you. I do invite participants who wish to ask a question to drop them into the chat, or you can raise your hand and ask Danielle directly. Okay, I do have a couple questions coming in here. Rachel asks, how do you talk to your kids about cancer?
That's a good question. And it depends on their age. And so it's going to be different based on how old they are. I'll say I actually have a blog about this. So I'll try and find it and post it for you guys or send it out. But when my daughter was younger, so back up, I've not been in active treatment as a parent. So it is a little different. I don't have that experience. Hopefully I won't. But my daughter was younger. She just knew it was kind of this icky, yucky bad guy. And as she's gotten older, I've given her more details and more descriptions. And I also try to involve her. So I've seen different parents in this space handle it differently. And I will say that the parents that do find a way to talk to their kids age appropriately and involve them, those kids seem to be more resilient and do better. I just actually hosted a roundtable with teens 2 nights ago, and some of them have had parents with cancer, and a couple of the guys have lost a parent with cancer and talked about how their dads were open with them about what they were going through and what they were feeling. And that has stayed with them. And they've actually continued to be involved in advocacy in honor of their dads. And so that's helping them cope with the loss of the parent. And so I'm a shameless advocate for advocacy groups. I think finding camps and groups of people going through what you're going through can be really healing for any age, and especially kids.
Thank you. We did have a question in the chat earlier, and it had to do with knowing that you have Lynch syndrome. Do you do other preventative screenings for other common cancers that may be tied to that, like ovarian cancer?
Yes. So once they concluded I had Lynch syndrome, I have actually had a total hysterectomy. So I went ahead and had preventive surgery because we knew ovaries and uterus was where it would probably head next. I was already infertile because of my treatments. So we made that decision, and now I get yearly colonoscopies because of Lynch syndrome. I have yearly UAs, blood work, more frequent mammograms than someone my age, skin checks. So yes, I definitely get screened quite a bit.
And I do see a comment related to your red lipstick. Can we ask the type of your red lipstick? Is there a shade or a brand?
So you guys, I feel like such an influencer. You want to know my lipstick? Yes. I don't know if the color still. So my sister-in-law sells Beauty Counter, and this is Girls Night Out from Beauty Counter.
I do have to agree with Shelley. It is pretty amazing.
I put on the brightest one for you guys, I have to say.
Yay, we love it. Does anybody have any other questions? Those are great questions, and we thank you for your candidness with us and sharing everything that you've gone through, and most recently your family's tremendous loss. I'm terribly sorry to hear about that, but thank you for sharing with us.
Thank you. I told my cousin Christy, she gave me those pictures with permission, because I said, hey, can I share this for this presentation I'm giving? And it brought a lot of healing to her to know this is how Nikki's legacy is going on. So thank you guys for not only being willing to hear my story, but my story of how it connects now to my family's story. It doesn't take away what happened, but it does help ease some of that pain.
Yeah, sure does. We want to thank everyone who has been here with us this week, and also note that you should please watch your email for a conference summary and evaluation. And we do thank everyone again for spending time with us. You will get more information in the chat here from me about the evaluation, because we can't stress the importance of that enough. So we do encourage you to fill that out.
Cindy, we're grateful to you for facilitating this afternoon too. Thank you so much. And
Thanks for
Danielle,
asking.
I just want to echo our thanks. Thanks for spending time with us today, and thanks for sharing a little bit of yourself today. We really appreciate it. I also just want to say again, thank you to all our speakers. Thank you to all our sponsors. thank you to all of our board members and members who participated in moderating and in the Meet the Member sessions. I think that added so much. Thanks again to Rachel Schramm, Liz Orton, and Kelly Rollins for all of their work putting the summit together. And if folks feel like just coming off their, I don't know, what do you say, not mute, but for your camera, turning your camera on and joining us and just wishing each other well for the weekend, or wave at your neighbor as you're signing off. Hope you all have a wonderful weekend. Thanks for spending the week with us.